This learning module is designed to provide practicing healthcare workers with the nuts and bolts about the requirements of the Health Insurance Portability and Accountability Act, HIPAA, particularly as it relates to patient privacy. HIPAA also contains legislation aimed at reducing healthcare-related administrative costs, eliminating pre-existing clauses and waiting periods for individuals changing insurance coverage, and increasing access to insurance for individual purchasers. Strict guidelines for maintaining privacy, confidentiality, and security of health information are also part of HIPAA legislation. HIPAA was designed to address public concerns about managed care, insurance availability, and insurance affordability. For example, HIPAA prohibits insurance companies from denying coverage because of 1. Pre-existing conditions, 2. A family member's health status, or 3. Whether or not an individual has been covered under a group policy and is seeking a personal health insurance policy. Further, HIPAA ensures immediate coverage without regard to pre-existing conditions for individuals who change jobs and insurance carriers. HIPAA also established a pilot program for medical savings accounts, MSS, that allows individuals to create a health insurance individual account to purchase health services and retain unspent funds rather than paying monthly premiums. Further, to encourage the purchase of long-term care insurance, HIPAA allows employers to deduct premiums and most benefits are tax-free to the beneficiary. Additionally, to facilitate purchase of health insurance by self-employed persons, the law allows 80% of the annual premiums to be tax-deductible by 2006. While many health policy analysts agree that these provisions have little impact on reducing the number of uninsured, they do, however, think these efforts are worthwhile. At this time, however, attention to HIPAA is riveted on implementing and paying for the privacy, confidentiality, and security aspects of the legislation. De Benedetto, 2003. A key factor for all healthcare providers and organizations to keep in mind is that, while HIPAA rules are strict, if state law covering the same topic is more stringent, the state law must be followed. Heron, 2003. Health providers are well advised not to overlook state law as they accommodate HIPAA. Providers and organizations must remain up to date with both HIPAA and state law changes. The intent of HIPAA is to protect patients from unauthorized or inappropriate use and access to their health information. Further, the rules protect patients by giving them access to their health information so they know what has been documented about their health status. Proposed byproducts of HIPAA are to improve quality of care, restore trust in the healthcare system, and improve the efficiency and effectiveness of information dissemination by building on existing legal frameworks. HIPAA also contains an administrative simplification section designed to improve the efficiency of health information coding to facilitate digital transfer of information between and among healthcare providers, payers, and health plans. HIPAA creates safeguards so that only those people or entities having a real need to know health information will be able to access it. Callaway and Venegas, 2002. The HIPAA rules complement other standards that protect patients' rights. Compliance with privacy rules promises to be a cornerstone of future JCAHO and Medicare, Medicaid surveys. Remember, compliance is mandatory, not voluntary. Why HIPAA is needed. Healthcare professionals have long realized the need to protect patients from unauthorized use of their health information. At the same time, they want to have access to needed information when treating a patient. Widespread use of electronic data is facilitating the rapid transfer of information, and the Institute of Medicine has urged the creation of standards so electronic records can be available. Understanding HIPAA. What is included in the law? HIPAA describes those affected by the law as covered entities. Included under this umbrella are healthcare providers, health plans, healthcare clearinghouses, and business associates. Healthcare providers are defined as anyone who is paid for healthcare services or bills for services provided. The list is all-inclusive: physicians, licensed healthcare providers, hospitals, outpatient physical therapists, social workers, certified nurse midwives, technicians administering X-rays done at home, home health agencies, pharmacists, providers of home dialysis supplies and equipment, nursing homes, nurses, and nurse administrators. This list means that any hospital or health facility worker who may see confidential patient information is included. Clearinghouses are those entities that receive health information from providers and health plans. They typically are responsible for standardizing the information to improve claims processing. Included in this group are third-party administrators, billing services, and repricing agencies. The business associates category covers a broad range of professionals and services. Included are attorneys, consultants, auditors, accountants, billing firms, data processing companies, and practice management firms. Nurses working as independent contractors, i.e., case managers, legal nurse consultants, and educators are included and subject to compliance with HIPAA law. A contract between the business associate and hiring agent must be in place before the associate can see any patient information.